A lot of people believe that testing fasting insulin is the smartest way to catch insulin resistance early or prevent diabetes. It sounds logical, right? But in reality, this test is rarely useful in the way most people think. It's not part of the official criteria for diagnosing pre-diabetes or diabetes, and insulin levels can fluctuate wildly, even from 1 hour to the next, without any real change in your health. One day your result might be high, the next day normal, and this can lead to confusion, unnecessary worry, and pointless treatments. The truth is, a fasting insulin test is only genuinely valuable when there's a strong suspicion of an insulinoma, a rare tumor in the pancreas that produces insulin uncontrollably, causing dangerous drops in blood sugar. In that context, measuring insulin alongside other tests can be life-saving. But if you don't have symptoms of hypoglycemia, doing this test as part of a routine checkup is a waste of time and money. For evaluating your real risk of diabetes, proven methods like fasting glucose, HbA1c, and the oral glucose tolerance test are far more reliable. And here's the big takeaway. Healthy lifestyle habits aren't something you wait to adopt until a piece of paper tells you. The numbers are bad. Everyone benefits from eating better, moving more, avoiding excess sugar, and staying active, no lab slip required. The carcinoembryonic antigen, or CEA, is one of those tests that sounds like a powerful tool for detecting cancer early, especially colorectal cancer. Many people assume it's a smart addition to a routine checkup, but in reality, relying on CEA for screening can be dangerous. This marker can be elevated for reasons that have nothing to do with cancer, smoking, a recent cold, inflammation, liver problems, and that leads to false alarms, expensive follow-up tests, and a lot of anxiety. On the flip side, some cancers don't raise CEA levels at all, which can give a false sense of security while a tumor silently progresses. The real gold standard for early detection and prevention of colorectal cancer is a colonoscopy starting at age 45, or earlier if you have a family history or certain genetic syndromes. A colonoscopy doesn't just find cancer, it can actually prevent it by removing polyps before they turn malignant. The problem with using CEA as a screening tool is that people with a normal result might delay or skip the colonoscopy they truly need, while others with a high result may be subjected to a chain of unnecessary, stressful procedures. If your doctor orders CEA without a clear reason, ask directly how the result will change your medical plan. In most routine cases, it won't, and your time, energy, and money are better spent on tests that can truly save your life. The point isn't to run every possible test, it's to run the right ones at the right time. Antithyroid peroxidase antibodies, known as anti-TPO, are often ordered as part of a thyroid check, but in most cases, this test does more harm than good when used without a clear reason. Up to 20% of completely healthy people can have elevated anti-TPO levels without any symptoms or changes in thyroid hormone function. The danger is that a high result can cause unnecessary panic, trigger more tests, and sometimes even lead to unnecessary medication. The test's real value is in cases where there's a strong suspicion of Hashimoto's thyroiditis, an autoimmune condition in which the immune system attacks the thyroid gland. Even then, the diagnosis is never based on anti-TPO alone. It must be interpreted alongside TSH, free T4, and sometimes a thyroid ultrasound. If anti-TPO is elevated but thyroid hormones are normal, treatment is not required, just regular monitoring and lifestyle measures that support thyroid health, like balanced nutrition, managing stress, getting enough sleep, and preventing deficiencies in selenium and iodine. The problem with ordering this test, just to check, is that it can turn a healthy person into a worried patient chasing a problem that doesn't exist. Before agreeing to it, ask your doctor, if this comes back high, what will change in my care? If the answer is vague or doesn't involve specific symptoms or hormone changes, you might be better off skipping it. The IgG food allergy test has exploded in popularity, often marketed by private clinics and wellness centers as a cutting-edge way to find out which foods are harming you. You get a colorful report showing dozens of problem foods, and it feels like you've uncovered the secret to better health. But here's the truth. Elevated IgG levels toward a food usually mean your body has been exposed to it, not that it's dangerous or inflammatory. In fact, major allergy organizations in the US and Europe have publicly stated that this test has no scientific validity for diagnosing food allergies or intolerances. The real danger is that people follow these reports strictly, cutting out highly nutritious foods they enjoy, which can lead to serious nutrient deficiencies, fatigue, hormonal imbalances, and even a damaged relationship with food. Over time, these overly restrictive diets can cause more harm than the problems they were meant to fix. If you suspect a true food allergy, the correct path is to see a board-certified allergist who can run validated tests like skin prick testing or specific IgE blood tests, which can accurately confirm an allergic reaction. Remember, just because a test is sold as advanced or modern doesn't mean it's useful. Sometimes it's designed more to sell a service than to help your health. Always ask how the results will change your actual treatment plan before agreeing to any test, especially one as controversial as IgG food sensitivity testing. Cortisol is one of your body's most important hormones, regulating everything from energy levels to your stress response and immune function. But testing it without a solid medical reason can do more harm than good. Cortisol levels naturally fluctuate throughout the day, highest in the morning when you wake up, and gradually dropping toward the evening. If you test at the wrong time, you could get a result that looks abnormal, even though you're perfectly healthy. This often leads to misdiagnoses, such as the trendy but unrecognized adrenal fatigue, and can result in unnecessary treatments. Cortisol testing is truly useful only when there's a strong suspicion of specific conditions like Cushing's syndrome, too much cortisol, or adrenal insufficiency, too little cortisol. In those cases, doctors use validated methods like the dexamethasone suppression test, a 24-hour urine cortisol test, or, in certain situations, a salivary cortisol test, but always with clear clinical context. The danger of routine testing is that it can lead to unwarranted prescriptions for corticosteroids, which, when taken without need, can cause diabetes, high blood pressure, osteoporosis, weight gain, and immune suppression. Before agreeing to cortisol testing, just to see, ask your doctor if the result will directly change your treatment. If there's no clear plan based on the outcome, it's better to skip it and focus on the lifestyle habits that naturally keep cortisol in check: quality sleep, balanced nutrition, and stress management. Prolactin is a hormone best known for its role in stimulating breast milk production, but it can fluctuate for many harmless reasons that have nothing to do with disease. Tight clothing that rubs against the chest, recent exercise, sexual activity, nipple stimulation, stress right before the blood draw, and even certain medications like antidepressants or blood pressure drugs can cause temporary spikes. When prolactin is tested just to check and comes back high, it often triggers a cascade of unnecessary follow-ups, repeat blood work, expensive MRIs, and even anxiety over the possibility of a pituitary tumor. The reality is, prolactin testing is only truly necessary in specific situations: unexplained infertility, irregular or absent menstrual cycles, breast milk production outside of pregnancy or breastfeeding, galactorrhea, low testosterone in men, or symptoms that make a pituitary problem likely. Even in those cases, an experienced doctor will confirm elevated levels with a second test under controlled conditions before recommending treatment. Acting on a single abnormal result without context can lead to over-treatment and needless worry. If your doctor wants to check prolactin without you having any related symptoms, ask exactly what they're looking for and how the results would change your care. Otherwise, you may end up chasing a problem that never existed, spending money, time, and peace of mind for no real benefit. Reverse T3 is a form of thyroid hormone that's rarely needed in routine testing, yet it's been heavily promoted by certain alternative clinics as a way to uncover hidden thyroid problems that standard tests supposedly miss. In truth, RT3 only has real medical relevance in very specific situations, like when someone is critically ill in the hospital and the body is intentionally altering thyroid hormone metabolism, a condition known as non-thyroidal illness syndrome. Outside of that context, measuring RT3 in healthy individuals or those with mild, Vague symptoms almost always causes more confusion than clarity. The danger is that some practitioners interpret a slightly high RT3 as proof that the thyroid isn't working properly and prescribe unnecessary thyroid hormone medication. This can have serious consequences. Long-term use without need can shrink the thyroid gland, cause dependency on the medication, trigger heart rhythm problems, reduce bone density, and increase fracture risk. If you have symptoms of a thyroid disorder, the first step should always be validated tests like TSH, free T4, and sometimes total T3, not reverse T3. Before agreeing to this test, ask your doctor how it will change your diagnosis or treatment plan. If the answer isn't clear, you may be better off skipping it and focusing on the tests that actually guide evidence-based care. Many patients assume that the more tests a doctor orders, especially ones that sound high-tech or complicated, the better their care must be. But in medicine, more isn't always better. Every extra test you take without a clear medical reason increases the risk of a false positive, which can set off what's known as the cascade effect: more follow-up tests, more costs, more stress, and sometimes even invasive procedures you didn't need. For example, an MRI done just to be safe in a healthy person might pick up harmless, incidental findings. These incidentalomas may have no impact on your health, but can still lead to biopsies or surgeries that carry their own risks. A good doctor's skill isn't in ordering every test available, it's in knowing exactly which tests are worth doing and when. Before agreeing to any comprehensive or cutting-edge exam, ask a simple question. If this comes back abnormal, what would we do next? If your provider can't give a clear, concrete answer, chances are the test isn't necessary. Prevention and screening are about precision, not volume, and the goal should always be to run the right tests for the right reasons at the right time, not to fill a file with impressive but meaningless results. For decades, medicine worked like a fire department. Wait until the fire starts, then rush in to put it out. Today, the best healthcare focuses on prevention, stopping problems before they begin. But prevention doesn't mean ordering endless lab panels just in case. True prevention is about controlling risk factors long before symptoms appear. That means maintaining a balanced diet full of nutrient-rich whole foods, exercising regularly, keeping a healthy weight, sleeping well, avoiding smoking, and limiting alcohol. The mistake many people make is waiting until a blood test shows bad numbers to start making changes. By the time that happens, silent conditions like high blood pressure, insulin resistance, or osteoporosis may already be developing. Good preventive care identifies your personal risk profile through a thoughtful history, targeted tests, and lifestyle assessment, not by throwing every possible lab test at you. Think of it this way. A normal lab report is just a snapshot. Your daily habits are the long-term movie. And that movie determines whether your future health is vibrant or filled with chronic illness. Prevention is built in everyday choices, not once-a-year lab results, and the best time to act is always now, not after your doctor circles something in red ink on a printout. One of the biggest challenges in modern medicine is finding the sweet spot between catching diseases early and avoiding unnecessary tests that can cause harm. Every screening tool, no matter how advanced, has a margin of error. A false positive can send you down a stressful, expensive path of biopsies, imaging, or even surgery you didn't need. A false negative can give you a false sense of security and delay diagnosis until the disease is more advanced. The key is to follow evidence-based screening guidelines tailored to your age, family history, lifestyle, and specific risk factors. For example, a low-dose CT scan can be life-saving for heavy smokers at high risk for lung cancer, but it's not recommended for young non-smokers with no symptoms. Likewise, a thyroid ultrasound is valuable if you have a lump or concerning symptoms, but meaningless as a routine, just-in-case test. Before saying yes to any screening, ask, if this test comes back abnormal, how will it change my care? If the answer is unclear or won't change your next steps, the test may not be worth it. Smart screening isn't about running every possible test. It's about choosing the right test at the right time for the right person, so you get the benefits without the unintended harm. In recent years, testing for vitamin D levels has become almost as common as checking cholesterol, with many people believing it's essential for everyone's annual checkup. The reality is, for most healthy individuals, this test is unnecessary. Major medical organizations, including the Endocrine Society, recommend vitamin D testing only for people at high risk, older adults, patients with osteoporosis, chronic kidney disease, certain autoimmune disorders, digestive conditions that impair nutrient absorption, or those on long-term medications that affect vitamin D metabolism. The problem with routine testing is that it often leads to unnecessary supplementation, which can be dangerous. Too much vitamin D can raise calcium levels in the blood, increasing the risk of kidney stones and even kidney damage. Another overlooked fact is that low lab values don't always mean you're deficient. Levels naturally vary by season and sun exposure. The best approach for most people is safe sunlight exposure, a diet that includes vitamin D-rich foods, and supplementation only under medical guidance. Testing should be a targeted tool, not a routine ritual, and taking high-dose supplements, just in case, can turn a health trend into a health problem. The idea of getting a full set of heart tests sounds smart, especially since cardiovascular disease is the leading cause of death worldwide. But not everyone needs echocardiograms, treadmill stress tests, or coronary CT scans as part of a routine checkup. In healthy young people with no symptoms or significant risk factors, these tests often pick up incidental, harmless findings that set off a chain of follow-up tests, anxiety, and even unnecessary invasive procedures. True heart disease prevention starts with the basics: checking your blood pressure, cholesterol, and blood sugar, understanding your family history, and evaluating lifestyle habits like diet, exercise, smoking, and stress. If you have symptoms such as chest pain, shortness of breath, irregular heartbeat, or a family history of early heart disease, then more advanced testing may be warranted, but it should be targeted, not scattershot. A just-in-case approach often wastes time and money while exposing you to risks you didn't need to take. Before signing up for an expensive cardiac package, ask your doctor, do my symptoms or risk factors justify these tests? The best cardiac care isn't about doing more tests, it's about doing the right ones for the right reasons. Many people walk into a doctor's office asking for a blood test that checks for all cancers, thinking it's the ultimate reassurance. It sounds appealing, but the truth is there's no single test that can detect every type of cancer early and accurately. Tumor markers, the substances these tests usually measure, are primarily useful for monitoring people who already have a diagnosed cancer, not for screening healthy individuals. In someone without cancer, levels can be slightly elevated due to infections, inflammation, smoking, or liver problems, triggering unnecessary panic and a wave of costly imaging and biopsies. Even worse, some cancers don't raise tumor markers at all, so a normal result could falsely convince you that you're in the clear. Real cancer screening relies on proven methods tailored to specific risks: mammograms for breast cancer, pap smears for cervical cancer, colonoscopies for colorectal cancer, and low-dose CT scans for high-risk lung cancer patients. The takeaway: if someone claims to offer a universal blood test for cancer, it's more marketing than medicine. Always ask how the result will guide your care. If it won't directly change what you do next, it's not worth the time, money, or worry. Direct-to-consumer genetic tests have exploded in popularity, promising to reveal everything from your ancestry to your disease risks and even the perfect diet for your DNA. While some of this information can be interesting, much of it isn't clinically useful, and in many cases, it can be misleading. Many genetic variants that these tests report have only a small influence on disease risk, and that risk can be dramatically altered by lifestyle and environmental factors. Results are often delivered without proper medical interpretation, which can lead people to unnecessary fear or, on the flip side, false reassurance. There are legitimate medical genetic tests, such as BRCA1/BRCA2 for hereditary breast and ovarian cancer risk, or specific heart disease gene panels. But these are typically ordered based on family history or symptoms and interpreted by a qualified professional. When done without that context, genetic tests can flood you with data you don't know how to act on, and which may not require any change at all. Before you spend money on one, Ask yourself if the result will actually guide your medical care. If it won't, you may be buying curiosity rather than actionable health information. Every year, millions of people take medical tests they don't actually need, not because they're careless, but because they want to be proactive. The problem is that unnecessary testing can lead to stress, overdiagnosis, overtreatment, and even health risks that could have been avoided. From fancy hormone panels to full-body scans and wellness, blood work packages, it's easy to believe that more information automatically means better health. But the truth is, smart healthcare isn't about doing every test available. It's about doing the right tests at the right time, for the right person. The best decisions are made when testing is guided by your medical history, symptoms, and proven scientific guidelines, not by fear or marketing. So here's my challenge to you. Think about the last time you were offered a test you weren't sure about. Were you told exactly how it would change your treatment or improve your health? If not, you might have been about to take an unnecessary risk. Drop a comment below with the test you're unsure about, and I'll personally walk you through whether it's worth doing and what better options might be available for your situation.